Today we are going to talk about supplements. You can call these hair supplements, you can call them supplements, but we're going to get into it. I'm going to tell you exactly what you need to take in order to grow from your hair from complete balding alopecia, from a full head of hair like I did in 100 days. And these are going to be the specific supplements that I took in order to supplement my blood. Now, the thing is, there is no such thing as hair supplements. There are only supplements. And the reason for this is because supplements that are made specifically for hair, that are specifically labeled as hair gummies or hair, skin, and nails, or for hair regrowth or hair, anything related to hair, those supplements contain the same ingredients, the same active ingredients that you could find in each individual supplement. I highly recommend taking each individual supplement instead of taking the hair, skin, and nail supplement, because you can really control the dosages and the amounts that you need. So by the end of this video, you will be equipped with all of the knowledge of supplements, what to take, what not to take, what is waste of your money, and what you should actually invest in. So let's get into it. So the first thing I take on a daily basis every single day is a D3 and a K2. The reason you need to take a D3 with the K2 is because it works like the lock and the key. The D3, which is for your happy hormone, we can call it the happy hormone because studies have shown that a lack of vitamin D in your system causes depression, causes sadness, and more vitamin D in your system not only helps with hair loss, it also helps with your immune system, and it also makes you happy. It is like getting the sun at all times in your home. And D3 cannot work without K2 because the K2 helps activate the D3. So basically what happens is the K2, which is the manoquinone, it helps activate the D3, which is the vitamin D that helps with bone development. I'm not going to get into too much scientific facts about this so that you don't get bored, but you need to take a vitamin D3 with a K2. Taking D3 along with calcium won't work. Taking D3 alone won't work. You need to take it with a K2. The next supplement you need to take is omega-3. Not 369, not omega-3 and 6, only omega-3. Omega-3 is a fatty acid. This helps with your increasing your HDL levels in your blood. The concept with hair growth is you need to understand the underlying cause of your hair loss. So if you are suffering from androgenetic alopecia, telogen effluvium, male pattern baldness, female pattern baldness, these are all because of two reasons, okay? The first thing is low nutritional value in your blood. So you need to focus on quality blood. And the next thing is your hair bulb and the dermapapillae cell. Okay, so if you work on the hair bulb and the dermapapillae, you will regrow a full head of hair just like I did, from complete balding, androgenic alopecia, to a full head of hair in just 100 days. So your focus should be on improving your blood quality, your blood cells, your ferritin, your hemoglobin, your B12, your vitamin D, your HDL, and lowering the LDL. What happens when you take an omega-3 capsule, I take 2 every single day, is that it helps increase the HDL, which is the good cholesterol in your body, and lowers the LDL, which is the bad cholesterol in your body. And what happens when you have high levels of bad cholesterol in your blood is that it clogs the artery. When it clogs the arteries, your blood cannot flow to the scalp. Okay, the main thing you need to focus on is blood flow to the scalp. The more blood flow can reach to the scalp, that means you have better hair growth and better hair quality. So I take 2 of these every single morning. They're big capsules, and you need to take these especially if you're not having good fatty acids in your diet, like a lot of fish, a lot of fatty fish. If you don't have that in your diet, if you don't have sardines in your diet, then I would highly recommend you take omega-3 2 capsules every single morning with your breakfast. The next thing I take is an absorbable B-complex. You need to look for absorbable B-complex because not every single supplement is made the same. It has to be bioavailable. That means your body can easily absorb it. Now, I take 1 capsule once a week. You don't want to overdose on your supplements because too many supplements, especially when you don't need them, they can cause toxicity in the blood, and then you will, instead of benefiting from it, you're going to start to have headaches, nausea, vomiting, dizziness. So that's what you don't want to do. Okay, so and you're going to overload your kidneys if you take too many of supplement. Too much of anything is not good. So once a week of a absorbable B-complex. This is with folic acid plus vitamin C. It helps absorb better in the body. The next thing I take is extra strength Ginkgo Biloba. This is 120 milligram. I take 2 capsules 3 times a week. Now, Ginkgo Biloba is known to increase blood circulation in the scalp area. Like I said, the main concept is blood circulation to your scalp. So I take 2 of these. They're like this, black. Take 2 of these 3 times a week. They're almost gone. And when you take this, you can really feel your head throbbing. That means you have good blood circulation. Now, at the end of this video, I'm going to explain to you who should take it and who shouldn't take it. So just stick to the end. Next thing I take is an iron supplement. Majority of the people, especially women, we lose a lot of iron in the blood because of our menstruation. And this might be very controversial, but it is a fact when you actually look at it in reality. When you take iron supplements that are given to you by the pharmacy, such as Ferromax, Ferrous Gluconate, Ferrous Fumarate, the ones you get on prescription, or even the iron IV that you have to physically go and get, your iron levels will still not go up. They will constantly, my levels were constantly between 5 and 7 when I was on those specific capsules that were given to by the pharmacy. The only way I increase my iron levels in the blood is by taking an iron that I can get off of Amazon. Now, these are bioavailable absorbable iron capsules. Okay, this comes with methylfolate, vitamin C, and B12. It helps to form red blood cells, enhanced absorption, and gentle on the stomach. This contains 120 capsules. But I will list in the description box below all the types of different iron that you can take to help increase my iron levels from 5 to 134 grams per liter. So which is really good. Okay, so you're going to need to take an iron supplement every single day. Now, before I go ahead and talk about further these supplements, so you need to be very vocal with your doctor. Okay, when you go to the doctor and you ask for a blood test, you need to tell your doctor that the reason you are getting a blood test is because you are losing a lot of hair. And the reason for that is because sometimes when you go get a blood test and you go to the doctor said your blood reports are fine. And that is because even if your blood levels are on the lower end of the spectrum, like there are levels for everything. If they're lower end of the spectrum, the doctor is going to tell you your report is fine. So what you need to do is, first of all, you need to tell your doctor that you want to get on the optimum levels because you are losing hair. So that way the doctor can actually tell you what the optimum level is that you need in order for you to grow your hair. And secondly, you need to learn how to read your own report. So I would highly recommend you go to a lab that you can check your report results online. So in Toronto, we have My Compass Care, so LifeLab does that. So what I just do is I go to LifeLab, I can check my own reports, I print out my own reports, it says LifeLab here. I just keep my reports for my own reference. And because I know how to read my report, it makes it very easy for me to target different areas on where I need to work further. So I'm going to read you my report after I'm done speaking about these supplements and why they are important. And I'm going to show you on the screen exactly what my levels are and why they are important. When you are dealing with hair loss, you always want to be on the higher end of the spectrum for every single thing, every single indicator, every single marker. And the reason for that is because when you are on the higher spectrum of the level of that specific marker, what happens is when your body goes under high levels of stress, all the blood goes to other organs in the body, okay? Because your hair and your scalp is the last. It's not needed for survival. What is needed for survival are your organs, are your adrenals, your kidneys, your liver. So what happens is the body rushes to these areas to help maintain these organs so that they can be prevented from the high levels of stress that you are going through. Now, that high level of stress can be anything. It could be because you moved, you changed the country, you changed the city, you changed the house, you have a change of job. For example, you are going through a breakup or you're going through a divorce. I went through high levels of stress during my divorce, and that is when I started losing hair. And that is when I started this entire journey. Now, when you are on the higher end of the spectrum, what happens is because you have a better blood quality, you have a higher blood count. So after your blood reaches those organs, it still has enough capacity to reach your scalp at the same time. But if your scalp is not getting the blood supply that it needs, for example, for 3 months, 6 months to 1 year, what happens is that your hair follicles start to miniaturize. And when your scalp follicles start to miniaturize, they start closing up. They become so small and they start closing up, and then the hair falls off completely from that area. And when that happens, that is when you experience the bald spots, and you can actually visibly see the bald spots on your scalp. So that is what you want to prevent. And that is why I'm talking to you about these specific supplements that you could take individually, and you can really cater it to your needs, so that you are not causing toxicity in the blood and you are not spending too much money on these hair, skin, and nails vitamins. Okay, so now let's go further and talk about what else I take. The next thing that I take is this Zinc Extra Strength. This is a liquid. You don't want to take this every day. You have to do a course of this. And by a course, I mean you need to take it 7 days only, 3 to 7 days in the entire month. And then once you take that, you will feel differently. And when you feel differently, then you don't need to take this in after that ever for the entire year. So you're going to only take it 3 to 7 days in the whole year, because this is extra strength zinc. You don't need to overdose on this. But for example, if your immune system is really weak and you're constantly getting sick and you're having trouble conceiving, you're having trouble with hair loss, you're having trouble with other areas of your life, for example, energy, you're feeling fatigued, you wake up and you feel tired, that is when you know that you are deficient in zinc. And trust me, 90% of the population is deficient in zinc. And that's even mentioned in this book right here, the Brain Savers Medical Medium series. And here it says, let me actually read the passage to you. Okay, so here it says, zinc is supposed to be our own immune system's #1 defense, and because we're deficient, we're in dire need of it. Zinc also slows down viruses and unproductive aggressive bacteria on its own merit. Viruses and unproductive bacteria are allergic to zinc, the mineral that repels and weakens them, even making pathogens docile, which allows the immune system to kill off and eliminate the pathogens more quickly. Many cases of infertility are due to zinc deficiency because procreation requires an optimal level of zinc, and excessive sexual activity can deplete zinc reserves, and 90% of the population is deficient in zinc. So it is very important to take zinc tinctures or zinc liquid and supplement your diet with zinc, because you are not getting it from anywhere else. Which is why, again, I highly recommend taking this between 3 to 7 days. You will know entire difference, and your hair will start to not only look better, but even like the quality will be better. Like you can see how shiny my hair is, and that's all you need to take in the whole year. Just take it 3 to 7 days in the entire year, and then the next year comes and you will be fine. You will not get sick. I haven't been sick for 1.5 years, thankfully, and it's because of the zinc. And this helps grow hair, because your nervous system needs to be strong in order for it to grow its own hair. And then lastly, at nighttime before going to bed, I take 1 moringa capsule, 1 zeaxanthin capsule. This is once a day for extra strength. It is 15 milligram per capsule. It has 60 capsules in it, and I take 1 capsule of bamboo silica. And this specifically is targeted for the hair and for the scalp. Now, how does this work? This moringa and zeaxanthin, these are two very powerful antioxidants. Now, the reason I take these two specifically, and you will know when you need to take them, is I get a lot of inflammation on my scalp. When my body goes through a very stressful time or my body is freaking out, then the only thing that gets inflamed the most is my scalp. And when that happens, I usually get a lot of pimples, a lot of redness, a lot of pain, to the point where I cannot put my head down on the pillow and sleep. It hurts. It's physically hurt. So because I take these two, it helps keep the inflammation down, and then because it helps keep the inflammation down, it helps regrow more hair, because in order for your hair to regrow, you need a healthy scalp environment. So we can talk about, I spoke about shampoos already in a previous video. You need to create a healthy environment with keeping keeping inflammation down. So along with this, I take bamboo silica. Bamboo silica is a plant that grows in the tropical rainforest. It grows very, very tall, and it is very popular. It's very known to grow strong, healthy hair. And by strong, healthy hair, I mean each and every single strand will become very, very thick compared to your original strands. And the reason you will know this is because before you start taking this bamboo silica, you're gonna first take a picture of your hair strands, or take a few pieces of the hair strand and save them. You're gonna put those in a Ziploc bag, and you're gonna put the date on it of when those hair strands were taken out. And then you're gonna start taking bamboo silica. And when you start taking bamboo silica, after 6 months, you are again gonna check your hair quality, and you're gonna take out the few strands, and you're gonna put them in a Ziploc bag. And then on the before one and then the after one, you're gonna put them on white piece of paper, especially if you have black hair, so that you can visibly see the quality of the hair strand. In order to see it further or see it better, you can use a magnifying glass, and then you will know exactly what is working for you. Forgot to save the bottle, but you're gonna need to take a prenatal vitamin if you're a female, and you're gonna take men multivitamin if you are a male. And these are the only specific supplements that you need in order for your hair to grow from complete balding alopecia to a full head of hair. You don't need any special biotin. You don't need hair, skin, and nails vitamins. You don't need other gummies. You don't need anything else. Just take these, take them in the frequency that I have specified. I will also leave the frequency and the dosages below. And on the screen, I will mention to you the exact levels of each indicator, each marker that you need to be on, and on the higher level of the spectrum. Okay, now I have my report here. So like I said, I'm going to put it on the screen, and I'm going to read out the numbers to you and tell you exactly what you need to be on and how you need to improve. Okay, so we're going to start with red blood count. Now, red blood count is your red blood cells, and like I said in the beginning of the video, you need to focus on improving the quality of your red blood cells. That is the only most important thing, so we are going to focus only on that. Okay, the red blood count, the level is between 4 to 5.10. I'm going to be putting it on the screen how it's written out, and my level was 4.53, which is excellent. Okay, next, hemoglobin spectrum is 120 to 160 grams per liter, and mine was 134. So if you're on the higher side of the spectrum, such as 150, which I'm going to try and get to 150, is going to be better for your hair growth. Hematocrit is, the range is 0.350 to 0.450, and my level was 0.404, which is pretty good. I don't need to go any higher than that because that is perfect amount that you need. Next thing I have here is vitamin B12. It says 307 was my result, and anything above 220 is really good. And then ferritin, I have, mine is 32, and anything between 30 to 50 is a iron deficiency, so I have to be on the higher side of the spectrum. So if you are between 45 and 50, that would be really good for you. So you need to I need to increase my ferritin just a little bit more. So I'm going to continue taking my iron supplements, and hopefully this will increase further in the next 6 months. And then next, hemoglobin, the A1C. This indicator marks diabetes, and the reason this is important is because you need to control your insulin resistance. I'll make a separate video on that, why controlling your insulin resistance is very important, and how you can. Insulin resistance makes the blood sticky. When it makes the blood sticky, it doesn't circulate properly and as well as it needs to. So my hemoglobin 5.6, and anything below 5.5 was considered normal. Okay, potassium was 5.1 as my result, and the range was 3.5 to 5.25. Potassium is very important in order for your potassium and sodium pump to work properly, which also is related to your blood. HDL, my HDL, which is good cholesterol, which I mentioned to you that the omega-3 increases the HDL, that was low. It was 1.22, and anything above 1.30 is considered really good. So I need to increase that a little bit further. So I'm going to start to take flaxseed oil liquid with honey, and I'm going to start taking cod liver oil liquid, because maybe I'm having some digestion issues or absorption issues since I take so many supplements. So I'm going to start to go on the liquid. The LDL was really good, 2.87, and anything below 3.5 is considered good. So that's also great. And then my thyroid stimulating hormone, I have dealt with Hashimoto's hypothyroidism, and I was on Synthroid and Cytomol and desiccated thyroid, but because those were not working, I went through a herbal route, and I used herbals to reverse my hypothyroidism without any Western medication. And I did that in 7 years. It took 7 years of consistent treatment with herb to reverse my hypothyroidism, and thankfully it was reversed. And now I am completely drug free. I'm not taking Synthroid, I'm not taking Cytomol, I'm not taking anything for my thyroid. So here the result was 1.85, and the range is 0.32 to 4, and free T4 was 14, so anything between 9 and 19 is considered great. So these were my current results. This is my report from, I went to the lab yesterday, which was November 17, 2025. So this is the most updated report that I am showing you. And like I said, there are some things that I need to improve further if I want to have better hair growth. And this is how you are going to read your report. So either ask your doctor for your report or go to a lab where you can print your own report, which will be beneficial so that you could target specific areas in your blood in order to have better hair quality, better hair count, and better blood count. So if you have any questions, leave them in the comments down below. I will answer each and every one of you. Check the description box. I will have the dosages, the frequency, and how much of each you need to take, which kinds of supplements that you need to take in case you missed it in this video. So to conclude with this video, don't waste your money on hair, skin, and nails vitamins. Don't waste your money on extra biotin. You don't need those. You just need these specific supplements. You can go ahead and implement this right now. So for people who should not take these supplements are obviously for pregnant women and for women that are breastfeeding their baby. You don't need to take these supplements right now, because what happens is if you take these supplements right now, it will also be absorbed in the baby, and that is going to be very dangerous for the baby because that's going to cause toxicity in the blood. So avoid these types of supplements when you are lactating and when you are pregnant. Also, for Ginkgo Biloba, people who are on SSRIs, antidepressants, or any type of Adderall, things like that, you should not take Ginkgo Biloba without asking your doctor, because Ginkgo Biloba can actually cause problems by interfering with those medications. So when you are taking these types of supplements, write them down and ask your doctor first, or work with your doctor. Like I work with my doctor. I told my doctor that every 6 months I need a blood test because I'm working on these types of markers, these types of indicators for this reason. Okay, your doctor is your friend. You need to speak to your doctor as you are speaking to a friend. You need to discuss with them exactly what the problem is, exactly what you are trying to tackle, and what you expect as the end result. Okay, so if you tell your doctor, I am suffering from androgenetic alopecia, I am losing a lot of hair, these are my reports, I want to work on these specific indicators, I want to take these specific supplements in this frequency, are you willing to work with me? And most likely the doctor will say yes, they are willing to work with you. So you're going to tell the doctor every 6 months I'm going to need a blood test, and they will be happy to give you that blood test every 6 months so that you know that by that 7-month mark, do you need to continue with these supplements or do you not need to continue with these supplements? If you have reached that marker on the higher end of the spectrum, then you can stop taking these supplements and just take them once a week for maintenance. Then you don't need to take them at the frequency level that I'm taking or I am recommending to you. So here, that is how you're going to be proactive with your own health and with your hair growth, that you can start from today and right now.